Um, I want to thank everybody for taking the time to be with us today. My name is Richard Torres. I'm the president of the Christus Foundation for Healthcare. This is a very important topic for us, both in Christus as well as for many individuals in our communities, especially those that are living in underserved communities and people that are particularly at the lower end of the socioeconomic level. It's something where we recognize that there are limited resources available in these communities. And so we feel like that it's important for us to help shine some light on some of the needs as well as resources that may be available and help people that are living in these communities, either being exposed to individuals through work who may be displaying signs of distress or family members or things like that. So what we're going to do today is just talk about the issue, talk about resources that are available. We'll be hearing from three subject matter experts, and then we will have a question and answer at the end of the program. I'd like to start and begin by thanking our three partnering organizations, the Michael DeBakey VA Medical Center for being here today, Project Change, and the Christus Health Plan USFHP. I also would like to thank members of the Board of Directors who are on the call today of the Christus Foundation for Healthcare. They are really the ones that help to allow us to be able to serve our communities the way that we do, particularly in, as I mentioned before, in those vulnerable communities. And I want to thank, special thank to all those individuals who are working on the front lines in this very important issue facing our community, particularly those needy families with limited access to these important facts. The purpose of today's call, as I mentioned, is to help those individuals, co-workers, and family members who may be facing, may be dealing with mental health issues, both individually and through close contact with those who may be demonstrating signs of mental health distress. Our hope is to provide information that will help you identify those resources that are available to you and help those individuals. I'll start by telling you a little bit about Christus Foundation for Healthcare, and then we will hear from our subject matter experts. At the end of the presentation, there will be an opportunity for you to ask questions. So with that, I'll begin. So with us today, the three speakers are Chantel Hemphill, licensed social worker. She's a suicide prevention coordinator with the Michael DeBakey VA Medical Center. Thank you, Chantel, for being here. Sarah Strang, who is the Mobile Crisis Outreach Team Program Director with Project Change. And then there's Myrna Saldana Trevino, who is a Community Outreach HP Coordinator with the Christus Health Plan USFHP. If you have questions, please use the chat feature. There will be a Q&A when all presentations are complete. Go ahead and send the question as it comes up, and then we will respond to them at the end, but we won't answer the questions after each speaker or during the speaker's presentation for the sake of continuity and making it easier for those individuals. So the name of today's presentation is Addressing Mental Health Needs and Healthcare for the Uninsured and Underserved Communities. I'll tell you a little bit about the history of Christus Foundation for Healthcare. Actually, Christus, through the Sisters of Charity of Incarnate Word, has more than a 150-year history here in Texas, starting in 1866 with the Sisters of Charity that came from Lyon, France. They arrived in Galveston, and they were here to extend the healing ministry of Jesus Christ through the work that they're doing for the sick and infirm of every kind. So the foundation really has always been for those individuals that are really the marginalized, the poor, those that really have no other options. And we have tried to maintain that continuity of mission. So, as I say, the work that we do is not always very popular. We don't get a lot of visibility from the standpoint of resources coming to the poor, but the work has always continued, and it's a work of love and a work of an obligation that we feel like that we have to honor the three sisters that came to Texas in 1866. In 1877, they started the St. Joseph's Infirmary, and it was the first general hospital in Houston. So they were real pioneers, and we continue to enjoy a great relationship with the sisters, and we're fortunate to have them here in the East End, and it helps to remind us every day of why it is that we come to work and why it is that we do this work. It's a very special ministry and something that we enjoy very much. And in 1999, the health systems of Sisters of Charity Incarnate Ward Houston and the Sisters of Charity of Incarnate Ward San Antonio combined to form Christus Health in 1999, which included St. Joseph's Hospital. And in 2005, St. Joseph's Hospital was sold, and with that formed the expansion of the St. Joseph's Hospital Foundation, which became the Christus Foundation for Healthcare. That's a little bit of the history of what we do. Programs that we offer are, we have 7 different programs. We have Operation San Jose, which is a mission trip that helps individuals throughout Latin America, providing free surgeries for cleft lip and cleft palate. We also have the Christus Our Daily Bread in Galveston, which is a ministry providing meals and counseling to the homeless in Galveston. Christus Point of Light is our standalone clinic in Dickinson. We also have a healthy living mobile clinic that serves about 30,000 patient encounters a year. They visit 400 sites annually, and 7,300 vision and hearing screenings. So that's really one that is done through mobile units and has been very effective in really being able to meet the needs of those individuals in their communities, and without expanding the cost or incurring a heavy cost of brick and mortar type facilities. We also have school-based clinics. We have St. Mary's Clinic, which is a newer of our ministries located in the East End of Houston. And we recently completed an expansion of that clinic, and it is now up and running in the new building. And then the Christus Learning Center, which was established in 2018 here at the Moran Center. So addressing mental health needs in our communities, it's an important, as important as medical care for underserved communities. And COVID-19, obviously, as you may have heard in the news, it has made mental health a more pronounced issue, especially in low-income communities. So the demand for mental health care in our service area is really what is driving this need to really provide much more information and just awareness about what mental health is, and what we can do to help those individuals that are in our communities. We're currently partnering with Chris Samaritan, a mental health provider, to provide mental health services at our Christus Point of Light Clinic in Dickinson and down in Galveston, Our Daily Bread, and that is a very good partnership so far. We also partner with Catholic Charities to provide mental health services at Christus St. Mary's Clinic and the Christus school-based clinics. We have physicians that provide, at both clinics, that provide initial screening for those individuals, and then those patients are referred to in-office treatment with counselors. This is relatively new, and this next coming year we are going to be expanding that. And expanding, what I mean by that is we're going to be putting more money into that, because we recognize that the ripple effect of what's going on with COVID-19, it's not going to be something that is just that we see right now, but it'll have an ongoing, more of a long-term impact in our community. So we're wanting to provide much more capability of being able to address those issues as they come up in our communities. I want to mention also about our East End Collaborative. We started last year in the spring by being awarded an $800,000 grant from the Hogg Foundation for Mental Health. And this is a 5-year grant to support the launch of the East End Community Collaborative in partnership with the Sisters of Charity and Carnivore Houston, said Jobs for Progress, El Centro de Corazón, Community Family Centers, and East End Unidos. The collaboration offers a systematic approach towards addressing social determinants of health in the East End. What they have decided was Hogg Foundation has always been supportive of mental health. That's been their primary purpose with their foundation. And rather than providing grants to people that were actually providing those services, they wanted to take it a step further and say, okay, what are those issues that are impacting the mental health of especially kids in low-income areas? And so we were one of 10 grantees in the Houston region to receive that grant. Our partnership with the collaborative is really to try to identify those individuals and individual organizations that are doing the work in the East End that have an impact on each of those social determinants of health. It's a new way of thinking, a different approach to approaching mental health. We think it will create some systemic change in the community, and we're grateful and fortunate to be able to participate in that. So that is our latest initiative that I think we'll see some benefits from. Let's see. Okay, so if you have any more or need any more information about the mission and programs of the Christus Foundation for Healthcare, don't hesitate to give us a call. We always like to hear from individuals and really understand what's going on in the community through our partners, but also through the people that support us and live in those communities. So with that, I will now turn it over to Mina, who will introduce the speakers, and we'll take it from there. So,
thank you. On the line.
All right, thanks so much.
You're welcome.
Okay, so I'm going to cover veterans and suicide prevention. And so in my portion of today's presentation, I'm going to discuss some statistics so that you have a general understanding of the scope of suicide within the U.S., know how to identify a veteran that may be at risk for suicide, and then some resources and things that you can do if you identify someone at risk for suicide. So currently it shows the numbers of suicide deaths in the United States, and there are about 47,000 in the general population. So that's about 129 suicides per day. Suicide is the 10th leading cause of death, and I really like to highlight that because we turn on the news, and when we see different headlines, we always hear about homicides and murders, but suicide actually happens a lot more. So suicide is the 10th leading cause, and homicide is the 16th leading cause of death in the U.S. When we look at suicidal behaviors, we know that men take their lives about 3.5 times the rate of women, but women are 3 times more likely to attempt suicide. And that is because men typically use more lethal means such as firearms. And that's important to just keep in the back of your head if you're working with a veteran or just in the general population. You want to always assess to see if someone has access to a firearm, and then you want to do some risk mitigation strategies, like have maybe a trusted family member or a friend remove that firearm out of the home, or even if the person is not willing to have the firearm taken out of their home, maybe even unloading the bullets and storing the bullets somewhere and then storing the actual firearm somewhere else. When we break it down by age and we look at suicidal behavior, between the age of 15 and 34, suicide is the second leading cause of death. So I think that that is pretty significant, and for us to also keep in the back of our minds. And then persons aged 65 years and older are at an increased risk. And especially during times like this when we're practicing social distance, and those who are 65 years and older are kind of in that vulnerable population. When we think about COVID-19, we want to make sure that we're checking on our older adults, making sure that they have the things that they need, that they are feeling support. We know that as people tend to get older, their quality of life can change. They're facing different mental and medical ailments that just kind of diminishes their quality of life, and that can be very impactful to their mental health. And then they're not working a 9-to-5, so they're not socializing as much as we socialize on a day-to-day, or maybe pre-COVID-19. So that isolation, that lack of interaction can really weigh on a person and make them feel like maybe a burden to their family, or that they just don't really have a sense of purpose. So specifically for our veteran suicide data, we know that about 18% of suicide deaths are veterans. However, they only make up 8.5% of the U.S. population. There are about 20 suicides per day for veterans, active duty service members, Guard and Reserve. But of that 20.6 figure, only 6 are actually connected to the VA hospital. And whenever I'm giving this presentation, I like to make a plug that, suicide prevention is everyone's responsibility. It doesn't just fall on VA. It doesn't just fall on the mental health community. It's really all of us working together, faith-based, medical, mental health, everyone working together to identify those that may be struggling. Because that figure, it shows 70% of veterans that die are not actually engaged in the VA. So we would never, run into these people. So we really relying on all of us working together to identify those that are at risk, and making sure we get those folks connected to treatment. So when we look at the method of suicides, it breaks it down from the left to the right, just the general U.S. suicides versus veteran suicides. And we see that veterans 70% of the time use firearms. And I think that figure kind of makes sense. Veterans are trained to use firearms. They're very comfortable with it. So again, we want to always assess to see if this person is in the possession of a firearm. I do also want to make a plug that at the VA we do have gun locks. So if you know of someone who may need a gun lock, I'll give you our contact information later in the presentation. But feel free to reach out to us and we can get those out to whomever may need it. Okay, so I want to take a few minutes to dispel some myths that we commonly hear as we talk about suicide and mental health. The first is that asking about suicide may lead to someone taking his or her life. And that is absolutely a myth. If you're not suicidal, me asking you if you're having suicidal thoughts is not going to create thoughts. But what it does is that it creates an opportunity for us to have a discussion. It gives that person, veteran or non-veteran, an opportunity to talk about what it is that's going on that may be leading to those suicidal thoughts. Okay. And then another myth or reality. So this person is not going to kill themselves. They just made vacation plans. They made a verbal written promise to me. They told me they wouldn't do it. They just know how much their family loves them. There's no way they would do something like that. And what we know is that when you're in that kind of that dark place, when you're in that state of mind, it can override any rational thinking. So we really want to take anyone seriously, no matter what we see going on in their life that appears to be great. If someone is expressing these suicidal thoughts or plan to die, we really want to take it seriously and get them connected to a clinical provider that can offer them assistance. So this is kind of the meat and potatoes of the presentation. Operation SAVE is an acronym, and it stands for Signs of Suicidal Thinking. So we're going to cover some of those warning signs, asking the most important question of all. V stands for validating the veteran's experience, and E is for encourage treatment and expedite getting help. So these are just some signs that you should look for. That hopelessness, feeling like, things are just not going to get better. I'm always going to struggle financially. My kids are always going to, give me a hard time. I'm never going to get a good paying job. Just feeling like there's no way out. You have no purpose. That's a really big one. Rage and anger. Feeling like a strong feelings of guilt, having anxiety, agitation. Possibly seeking revenge or just acting in a reckless manner, someone that's driving 115 miles per hour on the speedway and just doesn't really care about what happens to them. Increased drug or alcohol use, withdrawing from friends, family, or just society. Dramatic changes in mood, feeling like there's just no reason to live. They have no sense of purpose. Difficulty sleeping or sleeping all the time could definitely be an indication of depression or maybe even suicidal thinking, and someone that's given away prized possessions. I think I'm frozen. Okay, so A is for asking the.
Are you muted? Can't hear you.
I'm sorry, can you hear me now?
Yes.
Okay, sorry about that.
No
So
worries.
A stands for asking the question. And I was saying, even as sometimes seasoned clinicians, those who have been trained, that work in the mental health field, sometimes they get anxiety about asking this question. But we have to push past that fear and ask the person. If we identify any of those warning signs, we want to ask, are you thinking of suicide? Have you had thoughts about taking your own life? Are you thinking of ending it all? And yes, it can be scary, but asking that question could be the difference between someone living and dying. So like I said, you want to ask it if you've identified warning signs. You don't want to ask it in a way like, you aren't thinking of killing yourself, are you? That sounds, really judgmental. If someone asked it to me in that way, I'm not sure I would want to answer that question. So we want to ask with compassion, open-mindedness, and then again, if that person is experiencing those thoughts, we want to get them over to someone in mental health that can assess further. So V is validating the veteran or that person's experience. So talk openly about it. Allow that veteran or that person to express their feelings. We want to talk, we want to listen more than we talk. This is not the time to argue perhaps about your spiritual or religious beliefs. We don't want to pass judgment, obviously. We just want to be really supportive, reassure that person that help is available. And then the last part is E, and that's encourage treatment and expedite getting help. So if the person has already started taking pills, or they're sitting with a loaded gun, or they've already started to cut themselves, obviously we want to call 911 immediately and get them over to a hospital. Or there's also the Veterans Crisis Line. And for those who are not aware, it's a 1-800 number. It's available 24 hours a day, 7 days a week. You can press 1. Veterans can press 1. They're going to get connected to a mental health professional. And if that mental health professional deems that person to be acutely at risk, they're going to send rescue and make sure that veteran or that person gets to a hospital. It's also really cool if someone's just like having a really rough day. They may not be at the point of having suicidal thoughts, but they may want to talk to someone outside of their friends and family. They can call that number as well. And if it needs further follow-up, it's going to come to myself or one of my colleagues. We're like a team of 9 or 10 right now. And we will follow up on that call to make sure that person's needs have been addressed. So these are just some resources. MakeTheConnection.net is a really cool website that someone can go on, their veteran, their families, and they can hear like testimonies of other veterans who have overcame different mental health or medical ailments. And it's really cool because you can really break it down to your specifics. So let's say I'm a female vet. I served in OEF, OIF. OND war, I can break it down that specific. Or if I'm a male and I served in the Vietnam and I served in combat, I can break it down to hear stories for those people who were involved in that period. There's also the Vet Center, and the Vet Center is not VA, but they receive government funding. They provide counseling, and I think they primarily specialize in MST, so military sexual trauma and PTSD. But if you're wanting to find out the closest location, you can go to www.vetcenter.va.gov and type in your zip code, and you can find the closest vet center. And then there's an app, this Virtual Hope Box, which I really like. They have a section in it where you can, for those who may struggle with depression, suicidal thoughts, you can actually store photos and videos of your loved ones. So if you're having a really bad day and you kind of need that encouragement or motivation, you can go to that area of the app and kind of, look at videos that, may help to lighten your mood. Or if you're needing to relax, you can go through a breathing exercise or muscle relaxation exercise. So this is a really great resource, and you can find that on Apple and Android under VA Virtual Hope Box. And then we also have a PTSD Coach app, obviously for those who suffer from post-traumatic stress disorder, and that is also located on Apple and Android. So these are some important numbers. I really encourage you to jot them down. The first number goes to my team. If you need guidance or you are interacting with a veteran or you're concerned about a veteran, if it's during normal business hours, you can certainly reach out to us and we can see what we're able to assist with. We do try our best to answer that phone between 8 and 4, Monday through Friday. So if it's after hours, I would encourage you to reach out to the crisis line, or if it's like an imminent concern, acute concern, reach out to the crisis line. But if you just kind of need some guidance or you want to help someone get involved in care, you can give us a call. Or you can call the second number if you know someone, a veteran, who wants to initiate mental health care. And that number is also answered Monday through Friday, 8 to 4. We can help a veteran get connected to mental health. And then, of course, the crisis line. So these are some of the services that we offer. We have chaplain services. We obviously offer like inpatient hospitalization. We have voc rehab, mental health intensive care management. It's like a team of doctors and nurses and therapists. They actually go into the home, and these are typically for people who suffer from like schizophrenia and things of that nature. They go into the home and they work with them to provide services. And then we also offer outpatient counseling, mental health, and substance use. We do have same-day access, so if there is a veteran who is in crisis and they need to see someone in mental health, they can walk in and we can get them assessed that same day and figure out like a treatment plan and what needs to happen to get them in a better space. So that same day is offered at our main hospital, which is in the Med Center, Michael E. DeBakey. And then we have 9 outpatient clinics across the area. So Beaumont, Conroe, Galveston, Lake Jackson, Lufkin, Katy, Richmond, Texas City, and Tomball. And they also offer same-day access.
Okay.
Okay, and I'll be happy to answer questions once we wrap up.
Thank you, Chantel. I appreciate that.
Okay, so my name is Sarah Strang. I'm the program director for the Mobile Crisis Outreach Team with the Harris Center for Mental Health and IDD. And if you have not ever heard of the Harris Center for Mental Health and IDD, we are the largest mental health authority in Texas. The people that we serve 21,000 adult mental health patients. We have a psychiatric crisis unit and program or department, and that is also part of the neuropsychiatric center, which is next to Ben Taub. We serve 5,000 children with mental health issues, 4,000 that are in the jails, 21,000 with IDD and autism, and IDD stands for intellectual developmental disability. We also there's 19,000 that are in the Harris County Jail, and then the forensic mental health, the 4,000, is for those that are on probation and parole. We also have a jail diversion program, and both for adults and for youth, and so we've served one in the last year. And then also we have a crisis line that takes all of our crisis line calls, and they have received 126,000 crisis calls. Also, we have prescribed 274,000 medications. 80% of the people we serve have household incomes at or below the federal poverty level. And let's see. There we go. This is a map of the Harris Center sites. We have 2,400 team members who provide care in 86 different locations throughout Harris County. 30% of our services are delivered where people live, work, or go to school. And so we're very large and have a lot of different services that we provide our community. We have 4 adult clinics and then 2 children clinics, as well as co-location clinics that are in the schools. We also, like I mentioned, have NPC, the Neuropsychiatric Center, which is right next to Ben Taub. That is basically a psych ER for children and adults. So I'm the director of the Mobile Crisis Outreach Team, and the Mobile Crisis Outreach Team's mission is to provide rapid community-based crisis response and assessments to establish safety and provide interventions, skills training, and resources to restore the balance, self-reliance, and increase the support systems. And what the Mobile Crisis Outreach Team does is we receive, let me see if that works. We receive calls from anybody and everybody in the community that is experiencing a mental health crisis or needing to get back on medication, needing some help. Those calls all go through our crisis line, and then they get sent to us. So we are an interdisciplinary team that's comprised of a psychiatrist, licensed master level clinicians, bachelor level clinicians, psych techs. We also have now, as part of a side program that we're doing, which is Project Change, have hired a certified family partner that can help with parenting, and also a youth peer support specialist. And this youth peer is similar to the adult peers that we have at our organization that serve as a mentor to the consumers and they have lived experience. So our youth peer has had lived experience within the juvenile justice system, has a mental health diagnosis, and also a substance abuse diagnosis. And so she's going to be helping the young adults who are in the Project Change program that we have. So the MCOT provides services anywhere in the community. We will go to somebody's house, we'll go to shelters, we've gone to churches, we've gone to movie theaters, the side of the road, wherever somebody is needing help, as long as they are voluntary and not aggressive at that time, then we will go out to where they are and help them with what's going on. They're screened through the crisis line. I have currently with COVID, we are kind of working a little bit remotely, but have the Midtown location open, which is where I am today and every day. And then we have a team from 7 to 3:30, and then another team from 1:30 to 10. And then we have people that are on call that come in. If there's a call at 2 in the morning, they will come in and provide the crisis services that are needed. But when we are fully operational, we have staff at both locations to be able to disperse them quickly to the different areas of Harris County. So who are the clients that we serve? We serve all residents of Harris County. That's the one requirement, 0 to 100, or however the oldest person might be that needs help. MCOT provides services to children, adults who experience mental health crisis, clients who are in a mental health crisis but are unable to or initially unwilling to access services through traditional psychiatric outpatient hospital settings. Maybe transportation is always a big barrier, or just, really not able to walk into a clinic to get the help that they may need. Somebody who is at risk for hospitalization without immediate intervention. So we will transport somebody to the hospital if they cannot safety plan, but our goal is to be able to try and treat that person where they are and do a safety plan, do an assessment, try and schedule with our psychiatrist within less than a week. Sometimes we can do even same day or next day, and get them started on medication, help them get stabilized, and then we will look at linking them to long-term services. So, and then some are not in acute crisis, but they need help with getting back connected and just really are not able to do that on their own. And so we will help them with that. So we have 3 different levels of calls. So when the crisis line sends us referrals, they categorize them as either emergent, urgent, or crisis prevention. And emergent is somebody that is suicidal with a plan, or homicidal with a plan, actively psychotic, but voluntary and knowing that they need to get the help that they need from us. And so we respond as soon as we get that call. We're out in the field, going out into that call. The urgent cases are somebody that has a history of suicide attempts, is saying that they're actively suicidal, may or may not have a plan, and can kind of be okay for a couple hours if we can't get out there immediately, but really needs to be seen the same day. And those cases, we have 8 hours to respond, but if we don't have another call to go on, we go as soon as we can. So oftentimes those are seen within an hour or 2 as well. That's just the state criteria for an urgent call within 8 hours. And then our crisis prevention referrals are engaged face-to-face for crisis intervention and assessment within 24 hours from the time of the referral. Right now, our crisis prevention we are doing over the phone unless we determine they need face-to-face because they may need to be taken to the hospital or just really need somebody because they really have a lot going on. Then we will disperse our team to their home. Clients are seen weekly for approximately 4 weeks in order to establish linkage to long-term mental health. Best place for them to be linked to. We don't necessarily use our own clinic. We can use federal clinics. We can use a private provider that's near them. We want to make sure that when we're linking somebody to long-term services, that it's somewhere they can get to when we close out our services. And so it makes the most sense to look at where they're living, what they're able to, if they're on a bus route or if they're not, then what in the community. Sometimes we link them to, churches for counseling, to people that will come out like us for long-term counseling, like Mosaic Tree is an option. a variety of community settings. Routine case management hours are from Monday through Friday from 7 a.m. to 10 p.m., but we are 24/7 as far as our crisis team goes when people are in need of that. So the way the referral process works is that referrals can be made by anyone in any organization. We're open 24 hours, 7 days a week. Referrals are made by calling the Harris Center Crisis Line, and that number is below. It's the 713-970-7000, and then you press option 1 for the crisis line. And a crisis line specialist will then get on the phone with you, and they're going to ask a lot of different questions and demographic questions. So it's helpful if you have the person that's needing the help there with you. But if not, they will still try and get all of that information that they can from you, and then they will call the client. Right now during COVID, we are asking questions about what they've been out of the state, if they are currently having symptoms or have been around somebody that have had symptoms, and if they answer yes to any of those, then MCOT will then MCOT will not go to the home, but we will need the ambulance or EMT to go out, and then the police can follow up afterwards to get them a detention order to the psych hospital, and that's what we will do. And the crisis line has kind of been working with the referral sources and with the clients to get that done. And then, if we then need to follow up, we have a couple consumers that are positive for COVID right now. We are just talking with them over the phone, but they're stable in their home. So financial responsibility is always a big question. We accept any and all insurance at the Harris Center. We also accept those that do not have insurance or do not have the ability, to get Medicaid or Medicare due to being undocumented. So clients without insurance, there's financial assistance that's provided for services based on a sliding scale. Clients and their families will need to apply for the financial assistance with the help from the Harris Center. And then the financial is active for 1 year. And I will show you, this slide kind of shows all the way to the, the highest income, but this is a good way to kind of understand what it would cost somebody, because for us, we know that that's another burden for people is, how much is this going to cost me? Am I going to be able to, to actually do that, or is it going to make things worse? So if we're looking at this, and I'm looking at the monthly gross income of $2,850, that would require that the person pay, if they are single and have no dependents, then they would pay $103 a month. The majority of our clients do not make that amount, but with that $103 per month, that includes their meeting with the doctor, that includes their meeting with the clinician. Even if they met with the doctor and the clinician each day, it would just be $103 per month. And that also includes the cost of their medications. So when you take all of that into consideration, it's not as seem, for the family, because something in private pay, if you're just going to an outside psychiatrist, would cost you much, much more. Also, if they have, let's say they had, it was a husband and wife that both needed services, both needed medication and to see the doctor and a therapist, then it would be $72 per month, and it's not per person, it's per household. So that $72 would pay for both the husband and the wife for all the services. And then again, if they had one child, then it would be $46 for 3 people that needed services, or even if there were 3 in the home, then it would be $46 for that person that is needing the services. So I think that's a pretty good deal. And that is all I have. So I'm all done. I know that I think we're about done. So if there's any questions, then we can go from there, but I'll let you take over.
Okay. Sounds good. I'm going to take control back and go to the next slide. Nope. Here we go. So my name is Myrna Saldana Trevino, and I am the Community Outreach Coordinator for Christus Health Uniform Services Family Health Plan. And today I'm going to go over how we help the family members of our service members as well as the community in health and wellness from a holistic perspective. Our whole goal for this event is to educate, I guess, the community and the faith-based community about who we are and that the resources are there so that we can share this throughout the community and hopefully be able to go into the faith-based communities and the community as well to let them know that we're here. Because it is the veteran, but it's also the community in and of itself that we are hoping to share the information with as part of the Mayor's Challenge for suicide prevention. So Christus Health has been part of the Gulf Coast for over 150 years, and Uniform Services treatment centers had been established during that time period. The Department of Defense decided that they were going to take those treatment centers, and that's how we became Uniform Services Family Health Plan. We are here to help the community, the family members, and the service member from a holistic perspective, from health and wellness, and also through community events and through our services. The family members, I think, really need to participate in the healing process, whether it's spiritual, emotional, mental, or physical, because frankly, all of those things interact with each other. If someone is sick from a physical illness, there are issues that come along with that. If someone has cancer, and that takes a long period of time to be able to recoup from that, how is that affecting the family members, and how are the family members interacting with the person who has that illness? And so we really think that being able to reach out to a specialist without having to get a referral within our plan is a great benefit for our active duty family members, for our retired military who are under the age of 65, for our reservists who are retired reservists at the age of 60, and our Medal of Honor service members as well as within the community in and of itself through our health and wellness events. The family is key to, I think, the full recovery of whoever is having the behavioral health or the physical or the spiritual type of issues. Some of the programs that are in our plan, you can see, are geared towards our military and our service members. We've got after deployment services within the Uniform Services Family Health Plan, the Coast Guard Employee Assistant Program in transition. So if they're moving from one location to another, or they're actually separating from the service, they can also reach out to that resource within our plan. We also have a military crisis line that can help connect them with trained professionals at any time. There's the 800 number and the press 1 to be able to speak with someone if they're having an issue. And then we also have the mental health benefits where we can find other tools and resources to help with anything that's happening within the family and the lifestyle. And then we also have our member services number who can also connect to an in-network specialist within the plan in and of itself. So as part of, again, the mission, our mission is the healing ministry of Jesus Christ, and to be able to help our service members get the best care that's available. And again, just want to reemphasize that we also reach out and go the extra mile. I recently had a member of our plan who needed to see a specific doctor that they were seeing in another plan. And we reached out to that doctor because they weren't in our network.
Hey, Myrna.
Yes.
We can't see your slides.
I'll just flip over to them real quick just so you can see them. I've already spoken to all of this, but this is the last slide. And in conclusion, we just want to talk about the fact that we do go the extra mile, and we do try to reach out to specific behavioral health doctors that may not be in our network that our members may need. We have caseworkers also too that reach out to our members if they're having a problem, just to check on them and see what's going on. There's an extensive list of specialists, and again, the no referral, which really speeds up that process to be able to get that help that our members would need. And then, of course, we try to include everybody in that holistic approach to make sure that everybody is participating, and the family members are also being addressed, because it can be worrisome. They can, maybe not have questions that they want to ask specifically to the person who's having an issue, but they could reach out to somebody else and talk to them about, those questions that they may have, because sometimes it can be a pretty sensitive subject. This is my contact information at the bottom. If you need more information, you can connect with me through Facebook and there's a Book Now button, and then also send me an email as well. Okay. But again, like I said before, we want to make sure that we are reaching out to the community as part of the Mayor's Challenge, and hopefully be able to do these kinds of events throughout the community. You can reach out to myself or to the VA so that we can coordinate all of that if you're interested in sharing this specific information to your local community. Okay, Richard, did you want to do the questions and answers?
Yes.
Okay.
Can you hear me?
Yes.
Okay, great. And I can hear you now, so
Okay.
figured out what was going on. So with that, if there are any questions, either for me or any one of the presenters, please let me know who your question would be going to, and then we'll have them answer. As far as the chat, there was a question that Kara had, and well, it looked like it got answered, but for the sake of everybody, the question was, for the gun lock resources, does the recipient need to be a veteran? There was no answer. Yeah. Okay.
Yeah. The recipient does not have to be a veteran.
Okay, great. Thank you.
I have a question on the gun locks.
Go ahead.
Are they a trigger lock, or because I think there are two kinds of gun locks. Is that correct?
I'm not sure the specifics. Elizabeth, do you know? Elizabeth is in the chat. They're barrel locks.
Okay. Thank you.
I have a question.
Go ahead.
Okay, so I'm Crystal. I'm the executive director of Wheelchairs for Warriors, and we deal with veterans who are just like kind of at their wits' end a lot of times, because they're waiting on different kinds of help from the VA, and so all over the U.S. they can contact all of the resources that you were giving, Danielle. No, not Danielle. Sorry.
Chantel?
Chantel.
Yeah, Chantel. Thank you.
Correct.
I can't see your name on my thing. Okay, so anywhere in the U.S., that's the same number, because we do post that 1-800 number a lot on our social sites. So perfect.
Yeah, it's toll-free national number. The cool thing about the crisis line number is if the person does need follow-up, it's going to direct them to their local VA. So like here in Houston, in those 9 CBOCs I mentioned earlier, we follow up on those calls. So if someone's calling from New York, they're going to, if they need follow-up, the person is okay with being followed up on, they're going to connect them with the VA in New York.
Yeah. So right before this meeting started, I had a phone call from one of our veterans' father, and he said he can't find his son, and he's really depressed. Anyway, so it was like one of those kind of phone calls, and I had just given them the 1-800 number.
Perfect. And then there are also suicide prevention coordinators at every VA. So if we know where this person is located, we can get them connected with the suicide prevention coordinators at their closest VA that can also assist.
Okay. Well, your contact information is somewhere because I'll probably want to chat with you offline then.
Sounds good.
Okay, perfect.
Is there any other question? Okay. If I understand that Danielle Ivy is going to be sending out the PowerPoint presentation to individuals that registered for today's event. I would ask that if you felt like this was a productive, helpful presentation, please let us know. If there's anything we can do to improve the presentation or the content, or if there is a desire to have a follow-up presentation, please let us know as well. You know, we in our communities that we serve with Christus Health here in Houston, there are a lot of veterans, and I think that sometimes people, what we find with the individuals we're serving is that there's a reluctance to reach out to other organizations because of a fear, I think, or a reluctance to reach out because they may be intimidated. So we do get a lot of people coming to us because of our affiliation with the church and with the nuns, and so we try to do our best to be able to make people aware of these resources. But any feedback that you can give us, we really would appreciate it. I'm sorry we ran long, but I think it was a productive conversation, and we look forward to possibly having another one, and wish everybody a very healthy and safe day to day. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Richard.
Yeah, thank you. And I did
Thank
also
you.
want to
Thank you, Richard.
Thank you. And I did want to again thank USFHP, the sponsor of today's call. Thank you.
Thank you so much.
Thank you.